There is one question I do want to ask before we kind of move on to getting into, let's get to year one, especially with the opening and being the fact now you were, as a associate at Conway, obviously you still had a leadership role as a dentist, but it wasn't the same, as stepping into, okay, now you're a leader, you are the leader, you are the only dentist at the practice. How did you handle that transition? I mean, was there anything that you did that you think helped you prepare to be that leader at the new practice?
Really preparation. And that preparation starts before you're even thinking about going out on your own. Read some books somewhere, I kind of forgot. And it said, when your associate dentist starts thinking and acting like the owner, that associate's making ways into progressing to that next level. So when I was an associate at my former office, like we talked about, 3-doctor, well-oiled machine, very good reputation. You got close to the staff, you got close to the patients. You were really nestled in that community. I also lived like 10 minutes away. When you start thinking kind of bigger picture things, and of course you're maturing in your profession as well, you start realizing, you have a specific way of doing things. Not that one person's way is worse or one's better. It's different. Everyone's style is different. Mm-hmm. In that office, there were 3 of us total. All of our styles were basically the same. We're talking minor things here and there, but it gets to a point where in an office atmosphere, you want a certain environment that is tough to ingrain in an office that's been there, and you're the most junior doctor. So, we're in an office where some of the staff were there longer than I was born. Mm-hmm. And it still baffles me because they're still there. Mm-hmm. And I have gray hairs and they're still there. And so it's tricky. It's not a bad thing that you can't do that, but it's very tricky. And it gets to the point that your mindset's there. You're able to give that product. You've had decent dental education, continuing education. You can provide a good service to patients at a good quality. Then it becomes, okay, I want it done this way, that way. I want to tweak it. I kind of want it in my image. So when you get to that point, all of that is preparation. You're preparing yourself for that, because if you're looking to acquire an office, it takes time. Mm-hmm. It's going to take multiple, probably bidding wars. Mm-hmm. I had a friend bought an office recently up the road. It took 12 months from initial conversation to him walking in the door as the owner. It's quite a bit of time.
We've had a few of those ourselves.
Yeah, it takes
an organization.
Quite a bit of time. Yeah. So you have to be prepared well before that. So if you're saying to yourself, I want to start an office, I want to acquire an office, your mind has to already be moving quite a bit, because it's going to be still a decent time. And then those obstacles in that time, as you know, are extremely different. That there are things you don't really know of. So it really comes down to the preparation in your day in, day out, honing in on what you do every single day, and even the little things. Like, I try not to waste materials. I try to, think long term. And when you get on that kind of mindset, that track, that you feel more confident, at least, that you can handle things when you're the sole provider there.
Makes sense. And it's one of those things, it's that ownership mentality. And I kind of had to laugh a little bit about, even not wasting materials, because that is something that, when you work for somebody else, it's like, you're not always going to be, it's not really on my dime, but, when you have that ownership mentality, you realize that this is costing the practice money, and being, I'm not going to say frugal, but at least being aware of that is actually definitely shows that you're making that switch to being an owner versus just being an associate. So that is something kind of amazing to see.
Yeah. It's costing for no reason. Instead of putting that into a better patient experience, it's just getting thrown in the trash. Mm-hmm. So those things make a difference long term.
Makes sense. All right. Well, let's kind of speed ahead a little bit. I'm going to throw some numbers out just so we can kind of talk about. So we make it through year one. We opened in December of 2023. We get to January 1st, 2024. In the first year, you guys averaged 150 new patients a month. You did about 1.4 million in revenue. To give comparison, the industry average is around 30 to 40 new patients a month per provider. And most single dentist practices will do about 1 million. It takes between 1 to 3 years to hit 1 million. Most will average about somewhere between $900,000 and $1 million from the numbers I've seen. What do you think are the top factors that allowed you to be so successful? Because I mean, those numbers are not. I mean, those are numbers to be very proud of. I mean, there's no question about it.
Yeah,
and from your point of view, what do you think were those factors that made you so successful and allowed that to happen?
Yeah, those numbers are. Sometimes we sit back and we don't believe it. Really, part of it comes from being in an area that wasn't crazy saturated. I solely believe it doesn't matter where you open an office, that there's always space for quality. That's why there's buildings with 3 dentists and they're all busy.
Mm-hmm.
Always space for quality. For us, why we had so many new patients right away, there was not that many offices around. People wanted someone new. It was a booming area. I think right now we're technically in the corner of Polk County. It's one of the highest growing counties in the country.
Yes, it is.
So that helps with new patients. But just because they're walking in the door doesn't mean they want to come back. You have to give them a reason. It really ties back to that patient experience. We are doing everything we can to invoke all 5 senses. We have a certain scent in the office. I don't tell anyone what it is, but I have it in my house as well. So if you come over, you'll know. Visually, it's appealing. The lobby has a ton of sunlight. It's very modern. It's very comforting. We have snacks. We have blankets. We have all. Comfort comes first because the dentist is a scary place to go.
Oh, absolutely. And that's actually the main reason. That's the number one reason why people don't go to the dentist.
Yeah, I had a filling done a couple months ago. Shout out Dr. Davidson. Thank you. It was a second molar, so the tooth furthest in the back. And I was like, I've had one filling before in my life, and I don't remember it. I was in college. And I was like, man, that's kind of loud. Because it's like right next to your ear. The next day, I made an order to order a bunch of earbuds in the office that match, obviously. And now we ask patients, if you're cold, give you a blanket. Hey, is your noise okay? We'll give you your earbuds. These things add up to where if a patient comes in and they're not expecting that, and they just feel way more comfortable, and we're taking considerable time talking to them, that makes a difference. I always tell people, like on days we're running behind and someone's wondering, where is he? I always tell people, listen, we're the kind of office where we're going to stay in the room until things are stable. As in, the procedure went well, we know we're all set. Questions answered, patient comfortable. Those can appear in varying forms, can also take a lot of time. Most cases, people are fine, they're cool, they're in and out. And I think when someone hears that, they're like, oh, okay, that makes sense. Because when you're in that situation, you don't want to be like, you seeing the dentist rush, because that kind of worries you.
Mm-hmm.
Like if you're in a flight, do you want to see the pilot rush on, rush off? Absolutely not. So you want to see someone who's kind of in calm mind, calm spirit. So I touched earlier, that is a ton of patience. Mm-hmm. But as the Novo, you have some time. So you might as well invest that time early into seeing those patients. So your staff is used to knowing how long you're going to spend in those rooms, which is a considerable amount of time. I think we said earlier yesterday, it was pretty busy in the office. Because procedurally, we did nothing complicated. I was so tired because I just talked so much yesterday on top of doing these procedures, which at this point, they're routine. But talking to that extent, not even just what we're doing today. I was talking to a patient about her new job for like 20 minutes. And I realized, I'm like, oh, you're here for some fillings. We need to get going here. That just makes people feel more comfortable. Because then they're not going to the dentist. They're going to see Dr. whoever, Dr. Nirh, Dr. whoever it is. And that just, in your mind and their mind, makes it automatically more personal. So there's people I remember that were there for their cleaning day one. So I've seen them 3-4 times just for those cleanings. And it's funny because I almost don't expect it sometimes to go, how's it going? And they're actually curious, like, oh, what have you been up to? How is it going? We saw your Instagram. How was your trip? And I'm like, oh yeah, it catches me off guard sometimes because you're not always used to that because I'm running around thinking of all these things. So it's really nice, but also then you realize like, oh, they like coming here, which goes a long way.
Well, you're building that relationship. And I mean, that's the whole thing. And dentistry is about people. And that's something that I think sometimes people forget. I think sometimes some groups and some dental practices forget is that, this is not a number. This is not a revenue number. This is a person sitting in this chair. And it's either you focus on giving quality, which will then take care of everything else. And you make it so that you understand I'm dealing with an individual, make them comfortable, make them understand that, this is not some place to be scared of. This is some place that if I'm telling you need to have something done, I'm being honest with you and saying, hey, look, this will, if you do this, it will make your life better. And, I'm not, there aren't dollar figures in my eyes when you walk in the door. It's more of the fact I see you as a human being.
Mm-hmm. Yeah. And the big thing on that is, what I see, I make sure they see. Mm-hmm. We take photos, we take x-rays, all that stuff. So we just want them to feel comfortable, because from the human standpoint, why would you want someone to be uncomfortable? I think you feel better if you leave 10 minutes late, but you had a good day, than 10 minutes earlier and you rush through everything. But also from a business perspective, you want that patient coming back. Mm-hmm. You want their families to come in. Mm-hmm. You want to grow organically through people that just trust you. Mm-hmm. So it all kind of ties in together, and it all just makes more sense.
Yeah, that makes perfect sense. And that's one of the things I will happily say that, our organic growth at all our practices has got to the point that we run very little advertising anymore almost across the board, which I think is pretty amazing. And that's, a testament to the teams that we have, like your team especially, that, you've built such a relationship and rapport with your patients. Not only have they left their reviews, they've given us testimonials, but they're bringing their friends in, they're bringing their family in, and those friends and family for more friends and family. And it just kind of becomes this like beautiful snowball almost of, it just building up steam down as it goes down the mountain it gets to that point where it's like, all we have to do is make sure that you guys basically you guys do what you do. Your response, I don't worry about you. You just take care of it. And we do what we do to make sure that, we're keeping you guys very visible in the community.
Yeah. I mean, it really, my brother always says my favorite word is compounding, because when you're designing an office, every little thing makes a difference, good and bad. I mean, there are things we had to change because, I just didn't like how they were going in the office. I had to change them. But the good things you do, when you keep doing them consistently, even now, some of my dental assistants are like, people really love that. I'm like, yeah, we thought it would work. It worked. And now this makes someone more comfortable. So these things you put in, these systems you place in, as they compound, it just grows the office. And it also makes it just a better place to go, a better place to work, because no one's coming in crying or scared or yelling. It's, pretty calm. So that's just enjoyable from, anyone involved.
Oh, absolutely. And I think that's a testament to, basically how you've been so successful. In fact, actually, I'd like to go ahead and just jump ahead a little right now. And let's talk about now, because obviously we're in year 2, we're 7 months in. Currently, you are on pace to hit $2 million in revenue, which is amazing, especially the fact you are a single dentist practice. You're up to about 655 reviews across all channels with a 4.9 star rating, which is phenomenal as well. And then on top of that, you're averaging about 136 new patients, which is expected because we want to see those new patients. As much as new patients are a sign of growth, it's also, you want to see those numbers kind of reduce, because obviously you want to make sure you're keeping the patients you've already brought in. So, and that's kind of leading me to kind of my next question is, do you have, for that retention, obviously you're building a good relationship, you're building that rapport. Are there any other things that you do or you have the staff do to make sure that you're for a retention strategy to trying to keep patients coming back? Is there anything you guys do that maybe might be a little different, or do you have certain things that you do to make that happen?
Yeah. Wow, hearing those numbers, it's kind of
it's mine. It is, yeah. Trust me. When I was talking with our CFO earlier this week about the numbers, and it's like the new patient numbers. I know, obviously, head of marketing, I know all of that, and I can tell you where they came from and all that kind of fun stuff. But the reality of it is that even for me, looking at those numbers, they're a little mind-boggling, knowing that you're a single dentist, and that's. We have practices that do extremely well with single dentists, but I will say that number to me is still just mind-boggling. It's one of those things that, it's great. And it's obviously you're also retaining your existing patients. And, that's the part of it that, that's part of one of the things that I also look at is that, okay, obviously, yes, we want new patients. We want to hit a certain point, but we also have to look at the fact that, new patients, yes, they bring in growth, but you've also got to look at that stability, and that's where your existing patient base comes in. And that's where I kind of wanted to see if there was anything else you could add to any strategies or anything that you think about as far as things you could do to help make sure that you're keeping those existing patients.
Right. When we have patients that are existing, that have been seen over and over, and something happens that they need some treatment, then, it goes back to why they're there in the first place. Dentistry, right? You need to make sure your craft is there. The quality's there. You see a lot of places, they send, dental materials, their labs, they're in different parts of the world. It takes 3 weeks and a break, 3 more. Everything we do is usually fairly local, and we make sure to the highest standard. Because it's not just going through it, because it's not fun getting dentistry, right? The whole process from walking in the door to sitting down goes smoothly. The procedure goes smoothly. Talking to me goes smoothly. For example, I always tell people, I used to tell my office this, now they just know. The appointment starts when they open the door, not when they sit down. Okay, we have coffee machine, we have water, we have a nice lobby. It smells nice. We take them back on time. I talk to them at length of what we're doing when we're administering anesthesia. I have plenty of tricks in my bag to make sure it's comfortable. A lot of people even say, oh, that wasn't that bad. I barely even felt it. Or I've had the lucky ones go, when are you giving me the numbing? I'm like, I gave it to you 5 minutes ago. That's why your lip is huge right now, Those things make a difference.
Right.
And the situation I think back to, we had a patient, front teeth needed some work, existing patient. And when it involves front teeth, I take a lot of photos. I take a lot of records, basically, on top of the usual scans and all that. And went through the process. And even just us doing that shows, I feel, credibility to the patient that, hey, this isn't our first time doing this. We're trying to get the colors right. We're trying to make it to match your teeth, but your face. This needs to look good. I want you to not be worried about smiling and how this is going to look. And the process was straightforward, because to us, it wasn't bad. It was a bridge on the front teeth he already had. We're replacing it, extending it. And we did all these things and came in. When he got the bridge, went beautifully, little to no discomfort, and he loved it. And we didn't even ask him. He left us a raving review, and I saw him again for a cleaning, and he was so happy. And he had said, not to toot my own horn, he was like, I've lived all over the country. This is the best office I've been to. So just that mere attempt at doing more, and actually doing more goes a long way. So you're keeping those patients there. Again, that new patient number that's like astounding. But I'm attributing that to just, every week there's like a new apartment complex flying up here.
No.
So, but those things go a long way, because someone could come to you, but they can move the next week. They could lose their insurance the week after. So you don't really know how often people are going to come back. Usually they will. But those little things that are little to us, but to them they're different, and they seem like bigger, go a long way.
Well, especially with, I think it goes back to a lot of places they look at, hey, we could offer these things, but there's an additional cost or whatever. And it's like, to them, they're still looking at that bottom line versus understanding you're treating a person, you need to treat them like a person.
Right. And honestly, that bottom line, like that day might be less, but over the course of a month, it's going to be more, because if you're caring, you're going to get these bigger cases, and you're doing them well. They look good. They're successful. That patient that never smiled for his entire life is now smiling huge, and people are going to be like, what happened? How did that happen? Oh, I went to this office. I went to Dr. Nirh. I went to
suddenly
Dr.
you've got all these referrals coming in from it as well.
And it goes in. So it's just, not only is it the right thing to do, but this is one of those times where if you do the right thing, it will work out for you in your work and in your business. So they all play together.
And this is also why I have to say I'm very since I've obviously seen your growth since you've come into the company, it's like I really feel that you really embody who we are as an organization, and it's always great to see that and hear that have these conversations with you, because it's like I see it in action, and the fact that you do think like Dr. Kelly and Matt and myself, and you really have stepped up to being one of the leaders of the organization. It's just been awesome from the dentist side. So I have to say thank you for that. And I mean, it is kind of one of those things we're all very proud of your we are, as a executive team, I will say, and even as a corporate team, we are very proud of how you've grown and what you've been able to accomplish, because it is something. You look at these numbers, and like I said, it's like our practices all do well, but you guys have done something special, and you really have.
Thank you. Yeah, I think when we first met, I had one single gray hair in my beard, and now it's full of them. I think I have more than you right now, which is concerning. But I mean, if you just do the right thing, it goes a long way. And it's not even, I mean, a lot of young dentists, a lot of people have their own office or have partnerships or whatever it may be, or their associates. And there's a clear delineation between those who just take that extra step and, just clock in and clock it out. That's fine. You'll still, give a great service to your patients, but you can really see the difference. And it really comes down to like investing in yourself in courses. I mean, tens of thousands I've personally invested on these, and weekends I've lost going to Miami, Dallas, Arizona, whatever it may be, to be able to provide more for the patients.
I wouldn't necessarily say that you've lost them. It's like you're using your time efficiently, intelligently is how I would probably phrase that. But
in context for everyone, I said lost because me and Dave were talking about sleeping in on the weekends. So talking about waking up at 6 a.m. on a Saturday morning to talk about teeth. But getting them for a different reason. Yeah. Exactly.
Understand. And I think it's also understanding that, especially going into leadership, there are great resources out there how to be better leaders. Because I think that's something that a lot of people don't realize is that, some people, yes, they're born natural leaders. They have that natural instinct to do it. But for the most part, most leaders are made. They're not born. You actually have to work at it. You have to train for it. You have to, and there's a lot of great books out there. There's a lot of great, just even YouTube videos, to be honest, these days. You can find so many different sources. And that's the part of it that I always kind of find cool, is to see someone who's been able to take, who is that mindset of, I'm not going to stop learning, because I want to better myself. I want to be better at what I do, so that it reflects on the organization. And it also allows you to be a better dentist and a better leader at the practice. So that is something very cool. I guess my question, and I know it's not in something we already talked about, but with the leadership side, were there any books or were there anybody that you kind of followed that you kind of said, hey, this is, I like what this guy's saying. Let me learn more.
Yeah. Years ago, I read a book about Amazon, how Jeff Bezos did everything he did. And I think that was like 5 years ago. And that just led to like a ton of like nonfiction books. Shoe Dog by Phil Knight was awesome, because you realize it was very bumpy for a long time. And that is about the story of Nike. So Nike, Amazon, obviously, a dental office is a small business, but there's a book by the famous Navy SEAL,
Jocko Willink.
That's a popular one. Power of Habit. That series is a great one, because you're not gonna. It's like 200 pages. You're not gonna remember the entire thing, but you're gonna remember the examples they set in, and then that will help you remember X, Y, and Z. Especially nowadays in like this digital age where I am guilty of it. I lost 30 minutes last night just scrolling on my phone. It's a pretty bad habit to get into. So doing those things and reading those books kind of helps you just realign yourself every so often, take a different viewpoint. There's another book, I think Power of Habit.
Yeah, a very good one too.
And there's another one I read. I forgot what it's called. It's about habits, about mindsets, varying mindsets. And I think it's like 7 chapters. And each chapter you can read kind of separately. So there were times, just in life in general, I would reference that. Those things help. Whether you know it or not, often, obviously the Dale Carnegie book, Power of, Influence and all. That's like the most popular book in any 27-year-old.
Yeah, no, pretty much. It's that. Well, I mean, it's stood the test of time. There's a question.
It's a quick read too. A quick flight. You can read that. Read that one, and it's funny because when people read these, you can almost tell when people just read the book. You're kind of like, okay, but over time, it becomes something you just inherently do in every form of life. Like you, Well, you go to the gym first in the morning. I go to work.
Actually, I do it the other way. I do it after work.
Oh, me too.
I am not. No, actually, when you said, I kind of laughed. It's like I was always a night person, and then somewhere along the line in my life, my internal clock decided that I was getting up between 6 and 6:30 every morning. It didn't care, and I had to adapt to being a morning person. So, but I'm totally like you. It's like I need like an hour in the morning just to even get my brain functioning.
Yeah. Thankfully, I have a 30-minute drive in the morning, so that's my time. But you're at the office. And then if you want to get everything you get done, you want to go to the gym, you want to cook dinner, and you want to do all that, and it's not 11 p.m., you got to have these good habits so they kind of follow you everywhere you go.
I totally agree with that.
A day like today, very busy. But in itself, it's very fulfilled. It gives you quite a bit to do in your day. It makes it more fun. I don't know. It's one of those things that when you look back 5 years, you're like, oh, why did I do that? And you think of all these things you learned, how you learned them, all those, books kind of tie in, so anyone who's looking to, grab some books to read. Personally, The Power of Habit was one of the first ones I read.
That would be a very solid book to start with.
It's a series. I think there's like 2 or 3 of them. I read 2 of them. Those are really good.
Yeah.
And the Dale Carnegie book is obviously.
Oh yeah, that's almost like required reading at this point.
There's one by I think it was author like Mark Manson, like F-word your mind or something.
Yeah, I know what you're talking about.
That was pretty good too. It just helps you in, again, the lives we live today with all the social media, which you and I are very involved in.
Yes.
It plays a toll on your mind, and you can feel it in the evenings. You do it more. So having those things in mind just helps kind of clarify things and helps you navigate through that block things put in your mind there. So yeah, it was those things really that make a difference and practicing them. So
I know we've been talking for quite a while, and it's been actually a great conversation. No, I have to say it has been a great conversation. Yeah. I think you've given us a lot of good insights that I think a lot of our audience would definitely relate to, or even could learn from. But I do want to ask a couple of questions, since we're now year and a half over a year and a half into the de novo. What are some of those lessons that you think you've learned the most, and that if you had a dentist come to you, hey, I'm getting out of school and, looking at what I want to do, and it's like, I'm thinking about opening a practice, what would you tell them? What are some of your lessons learned that you might want to impart on them, or those, pearls of wisdom to say, think about this? And I know you've had some great ones, especially expect the unexpected, because I think that is, as a business leader and a business owner, that's pretty much I can tell you all sorts of stories about things that have happened to me, where it's like literally walking in on Monday morning, like, what do you mean that happened? Okay, I guess I know what I'm doing for the next 3 days. Yeah. So,
it sounds cliche when you say stuff like that, but when you live it, you're like, oh yeah, because expect the unexpected, and someone who's in finance and someone who owns a dental office are very, very different.
Absolutely.
Honestly, if you're a dentist or a dental student and you're thinking about, going your own way, making your own office, first off, do it. Secondly, make sure you gather all the information you need, but what you can control is what matters the most. So hone in on your skills, make sure your quality is there. Your patient communication, make sure that's there. Those 2 things will take you further than anything else. I know dentists in the Northeast, they're great dentists, they're great communicators. Their offices look like they're from the 1600s, but they are super busy. Patients love them. Mm-hmm. When I was in dental school, an oral surgery attending once said, there's always space for quality, which we mentioned earlier. So obviously you want to find a good location, not as saturated, make it a little easier for you. But if you have quality, people will come. Mm-hmm. Might take a little longer if you're in, downtown Philadelphia versus Davenport, Florida, but people will come. So it really comes down to you. How much are you willing to put in to do that, and the patience you'll have to go through all of that? Because anyone that has started, acquired an office, dental office, business, whatever, the amount of patience and ability to move on to adjusting you need, it's exponential. It goes from just figuring out on a personal end what the patient needs. All right, we go home and go to the gym, be home by 5:30, Now you got to be extremely patient. There's an issue. You can't say, oh, well, figure it out, going home, see ya. How are you going to solve this? How are you going to navigate all the variables that are involved with that? So you have to kind of develop a mindset of doing that. And that is what makes the biggest difference. So, I think everyone says the first 10 months are pretty tumultuous, but after that, the payoff really is quite a bit worth it, because you're in a unique space where you're where you want to work. You're making it everything you want.
Mm-hmm.
Do you want to put a slide? Yeah. There's a dentist in Utah that has a basketball court in his office. That's insane.
Yeah.
So you can almost do whatever you want, make it however you want. I know dentists that wear a shirt and tie every day. I know dentists that wear crazy scrub colors. So where do you want to work? That question you can answer yourself and then do it.
And some of it's also, I think, if you want that ability to control your destiny or have a say in your destiny, because that is one thing that, when you work for somebody else, you obviously don't have that level of control. It's, you basically, the only way to really get to that point is to say, okay, I'm going to do this on my own, or I'm going to partner with somebody that will give me the ability to actually, control my destiny, or at least have a say in my destiny.
Yeah, exactly. It goes down to really everything we touched on is you can make a whole space and whole business in your own image. So you're not only controlling your own destiny, you are controlling the results and the future of what walks in that door.
No, I think that's actually great advice for somebody. I mean, that's one of those things, and I think it's good to hear it from another dentist, because that's one thing, with this industry is that sometimes a lot of dentists aren't willing to go on and do these kind of things and talk about, this is how I've succeeded, stuff like that. Or if they're trying to sell you a system that, well, it's a system. So it is great to have you come on and be very honest and talk about talk about these things. If you've got a few more minutes, I wouldn't mind asking just a couple more questions. The one thing that also we kind of touched on several times, but obviously your team has grown. When we started, you were a single hygienist, single assistant, single front desk. You're now up, I believe now you're up to, I'm trying to remember the numbers right off the top of my head.
So two front desk. One is the office manager. We now have 2 assistants and 2.5, 2 3/4, 2 1/3 hygienists.
So my one question with that is that obviously you've doubled in, the staff has grown over doubled in size. How have you kept your culture? I mean, I know it's one of those things, that's one of the big things that is probably one of the harder things as you grow, is to make sure that the people that are coming in, you're instilling those same principles in. Mm-hmm. So how do you think you've been able to accomplish that? Or how do you feel that that's been accomplished?
It's like the classic sport stereotype. Like they have to buy in, you have to show the staff firsthand. And once they buy in and they start enjoying that culture, they are the culture. They're part of that culture. They're ingrained in it. They're not just a part of it. They are the culture. And when that happens, when someone new comes in, it is seamless, because you want it to be a place where people like to work. Mm-hmm. So they generally like it. Have there been situations that haven't worked out? Of course, because we're not the best fit for everyone. And that's okay. I don't want to force anyone that doesn't want to be there to be there. To the point where if someone new comes in, it's almost like seamless transition, to the other staff is telling them, oh yeah, just do that, you're good, don't worry. Or this is how we do it, this is why, it's a little easier. It's just more comfortable. We hired a recent hygienist right out of school. That's a tricky position. Your first job out of school. Mm-hmm. I think she shadowed us for like weeks. And I was like, hey, you don't have to shadow us. It's okay. Like, you're hired, just come when you're ready, let us know when your license comes in. Because she saw the culture there and saw how close we were, and saw how, we often do like Starbucks Fridays where, for their late, Starbucks next door, we'll get a coffee. She didn't want to join and throw that off. Right. Or be the wrench in that wheel. So it's funny because it was almost like people are hired, they see that, and they quickly want to be a part of that. So it takes out the guessing game of, will they work hard? Will they provide that quality of care? And that's all happening while they're seeing you see patients. Mm-hmm. So it's, once you ingrain that and the system is there, growing becomes or even, if someone leaves and replacing the staff or anything like that, it becomes a little bit more predictable. Now, when you have a big addition, like a new doctor that comes with another new hire of an assistant, 2, 3 at once, that's obviously going to need some adjusting. And we'll do episode 2 then, because I have no idea what to expect. But that's really what it comes down to.
And it makes sense. I mean, it's one of those things, you build a good culture, you build it so that new people coming in, they see that culture and they want to belong to you. Basically, you're building not only like an extended or a second family, but you're also building an environment that they want to be part of, and they want to belong to something that's bigger, bigger than themselves. And I think that's kind of one of those things that I'm hearing from you, is that you basically, the culture you built makes it so that everybody's coming in the door, they want to be, they want to live up to your standards as the leader of the group, but they also want to be part of this bigger machine that is doing such amazing things for other people. And I think that's, it's great to hear.
Yeah, that's exactly it. That they're coming in and they know they're being a part of something that is doing good. So, and that's nice, because a lot of, staff that are looking for new jobs are part of these massive conglomerate dental groups. I'm not saying everything they do is bad. It's just inherently different from what we do.
Agreed.
Whereas
when you hear, and it's not to bash anybody or throw anybody under the bus or whatever, but when I talk to dentists that come from some of the bigger groups and they say that, it feels like the accountants are telling me how to be a dentist, that's not right.
Yeah. What's nice is when, if a patient leaves a cleaning and they see the assistant on the way out, they like wave to them and want to say hi and they hug each other. Where does that happen? I never go to the supermarket and hug my cashier that I always see every Sunday. So it makes for a special place. And so when new additions are in, they see that and they're very quickly like, oh, it's like a sigh of relief. Because it's not common you see that.
Yeah, and I would agree with you there. Especially we've experienced it on our end as well. So it's good to see. Dr. Nirh, I want to say thank you for your time today. It was awesome that you could come in. I think that it's been a great conversation. I've definitely learned a lot myself. And that's one of the things I always enjoy, being able to have these conversations with our dentists and doctors, because it's as the person behind the scenes trying to get you guys patients and making sure that things are going well, that it's good to hear these things, because it helps me do my job better. But it also the success that you've been able to achieve with us has been phenomenal. Seeing your growth has been amazing. I have to say, no ifs, ands, or buts. And I want to thank you for your time today, that you took one of your off Fridays to come in and actually sit here and listen to me ramble a little bit too. But all in all, just thank you for your time and thank you for coming out today.
Absolutely. Thank you so much. I hope, this episode, this podcast is helpful to any young dentist, dental student out there. And, if you ever want to reach out for questions, we'll be happy to answer and reach out to us. But yeah, I appreciate it.